Welcome to today's webinar hosted by Engaged, the National Resource Center for Engaging Older Adults, which is administered by US Aging. My name is Meredith Hanley. I serve as the Director of Community Capacity Building at US Aging and oversee the Engaged Resource Center. Our webinar today is called Partners in Social Engagement, Collaborating with Parks and Recreation Agencies. Today's webinar will highlight how opportunities for partnership between parks and recreation agencies and aging network organizations promote social engagement of older adults, caregivers, and people with disabilities. During the webinar, the National Recreation and Park Association will highlight how parks and recreation agencies are working locally to address social isolation and loneliness, and how the Aging Network can partner with Parks and Recreation. The County of San Diego Health and Human Services Agency and its Aging and Independence Services will then share how they developed collaborative efforts with their local parks and recreation departments to create opportunities for social engagement for older adults. All speakers will then share tips and strategies for Aging Network organizations looking to partner with parks and recreation agencies. Next slide. We have a few housekeeping items. All attendees of this webinar are in listen-only mode for the duration of the webinar. That means your microphone or phone will be muted, but there are still ways that you can engage with our speakers today. You can submit questions for the presenters at any time during the presentation by clicking the Zoom question and answer or Q&A button at the bottom of your screen. You can just then type your question into the Q&A box and hit submit. And we will be sure to save time at the end of the presentations to address many of your questions. There is also a chat feature. You can click on the chat button to submit a message to the host if you need technical support, and we will do our best to help you. And you can also use the chat to engage with other attendees as well. And the webinar will be recorded, and we'll share a link with you in the next few days if you want to re-listen to any portions or share a link to the webinar with your colleagues. Next slide. For those of you who are using a screen reader and perhaps want to silence unwanted chatter in the chat or Q&A boxes, you can activate the speech on demand feature by pressing insert spacebar and then pressing the letter S on the keyboard. And for those who are not able to use the chat feature and who would like technical assistance, you can raise or lower your hand. And you can do that on your keyboard by pressing Alt+Y. Next slide. Before we move into our speakers, I did want to share a little bit more about Engaged. Engaged is a national effort funded by the Administration for Community Living that is working to increase the social engagement of older adults, people with disabilities, and their caregivers by expanding and enhancing the Aging Network's capacity and reach to offer impactful interventions. Much of our work focuses on identifying and disseminating information about emerging trends, resources, replication strategies, and best practices. Engaged is administered by US Aging, and we are guided by a project advisory committee with representatives from 18 organizations and resource centers who provide social engagement insights from their fields of expertise. And we're fortunate to be joined by one of our project advisory committee members today, that being the National Recreation and Parks Association. Next slide. So with that as the segue, I just want to introduce our two fantastic presenters today, Tiff Cunin, Senior Program Manager with the National Recreation and Park Association, and Pam Plimpton, Intergenerational Coordinator with the County of San Diego Health and Human Services Agency, the Aging and Independence Services. So with that, Tiff, I will turn it over to you for your remarks. Thank you.
Great, thank you so much, Meredith. Hello, everyone. Thank you first to US Aging for inviting NRPA to this important conversation. We're just so glad that you could join us today as we discuss the important topic of how community-based organizations like park and recreation agencies can address social isolation and support healthy, holistic aging in our communities. I will do a quick introduction of both our organization and myself, but first, let's see how everyone is feeling today. So next slide, please. All right, I thought we could start the week off with a little smile. And if you're able to use your chat function, this would be a great time to do so. So let's do a quick temperature check. On the sheep scale that's on your screen, how are you feeling today? I myself am a chronic 1 and 9. So you can please put your numbers in the chat. Yeah. I see those. I see that Tuesday's the new Monday for a lot of folks. Yeah. Oh my gosh, this is great. This is great. As a data nerd, I would really love to be able to take this data and apply it somewhere, somehow. Oh, great. They're still coming in. This is great. Yeah, I'm a chronic 1 and a 9 on most days. So thanks so much for your participation there. Hopefully it gave you a little smile to kick us off today. Next slide. All right, so today, as Meredith alluded to, I'm going to provide a framer of the many benefits of park and recreation agencies and how they provide support to healthy aging at the community level. I'm also going to highlight how park and recreation agencies are addressing social isolation, including spotlights on local work, and also we'll share how the other aging organizations can partner with parks and recreation. Next slide. All right, so here's my big egotistical slide with my little peanut head in the picture and then my little name on the card. But I wanted to provide a little context about why I'm doing the work that I do and why I'm here. As Meredith said, my name is Tiff Cunin, and I'm a Senior Program Manager for Health at the National Recreation and Park Association, NRPA. I use they, them pronouns, and I've been with NRPA since October of 2020. I have a background in public health research and center my work on social justice and health equity. Today, I'm coming to you from Silver Spring, Maryland. And before moving forward, I'd like to acknowledge the traditional ancestral unceded territory of the Piscataway and the Anacostan people, the original caretakers of this land. At NRPA, I manage our healthy aging body of work and support organizational efforts to address systemic barriers to health among historically disenfranchised populations. This includes Black, African American, Asian American, Latino, Indigenous population, older adults, and the LGBTQI2S+ populations, among many others. Also, my doctoral research aligns well with my work at NRPA. I explore the experiences of aging among transgender older adults and how those experiences influence social participation, like participating in hobbies, getting physical activity and exercise, and meaningful community and social engagement at community-based organizations like park and recreation agencies. One other small acknowledgement is that I want to acknowledge the privilege that I've been afforded as a white individual and how that has played a role in where I am today. Next slide. All right, so we're going to get into the meat of what we do at NRPA and why we're here today. At NRPA, we seek a future where the full power of parks and recreation is widely recognized. We advance this vision by investing in and in championing the profession as a catalyst for positive change, for equity, climate readiness, and overall well-being. At NRPA, we know that parks and recreation is key to a fully integrated public health system, and parks and recreation are essential to improving health outcomes and strengthening community vitality. At the core of this work is equity. Unjust practices and policies have created barriers to achieving optimal health outcomes among Black, Indigenous, Latino, Asian American, and people of color, low income, under-resourced communities, and older adults. To truly advance health equity and ensure all people have a fair and just opportunity to be as healthy as possible, we must eradicate these barriers by reimagining and rebuilding our systems. This requires leveraging the power of parks and recreation to build upstream systems-wide approaches that support the equitable distribution and integration of more comprehensive health and social services through parks and recreation. Next slide. All right, now we're talking a little bit about the power of parks and recreation, and we're going to connect this to social isolation and to social connectedness for the aging population. Parks and recreation are vital to community health and well-being, as I mentioned before. Access to these spaces, programs, and services are essential to community vitality and are actually a key factor in advancing health equity, improving individual and community level health outcomes, and enhancing quality of life. Park and recreation professionals, the systems they manage, and the services they provide are key to a public health system. Park and recreation professionals are on the front lines of many of our most pressing public health and social challenges, from food insecurity to chronic disease, to mental health and substance use, to climate change and other emerging threats, including social isolation among older adults. Next slide, please. So how does Park and Recreation advance community health and well-being, and how is this connected to social engagement, social connections, and social networks? Well, we achieve this by championing Parks and Recreation to serve as stewards of community wellness hubs. Community wellness hubs are trusted gathering places that connect every member that advance health equity, improve health outcomes, and enhance quality of life. Community wellness hubs foster a holistic approach to wellness dictated by the community's needs versus being prescribed by the current systems, which continue to perpetuate oppression in forms like racism, classism, and ageism. Community wellness hubs build off of existing strengths, assets, and foundations of Parks and Recreation. This includes providing access to physical activity, healthy foods, green space, and social connections and cultural enrichment opportunities, while also integrating more comprehensive and holistic health and social services to support the well-being of older adults. This may include creating linkages to accessible healthcare and chronic disease management programs. This may include connecting people to social services like job training and supplemental benefit programs. This can also look like integrating mental and behavioral health services and connecting people to other needed community resources. Next slide, please. So NRPA has been in the healthy aging space since around 2013. However, we have received full support from the CDC since 2016 to do this work. And since 2016, with full support from the Centers for Disease Control and Prevention, NRPA has worked to enhance the health and wellness and quality of life for adults living with chronic conditions like arthritis. This work has been focused on increasing the availability, participation, and sustainable supports for arthritis-appropriate evidence-based interventions. Yes, that is a mouthful. I'm going to refer to arthritis-appropriate evidence-based interventions as ABIEs for the purposes of not confusing folks and not having to repeat that whole acronym again. These ABIEs can help improve arthritis management, physical activity participation, and health-related quality of life for a portion of the more than 58 million adults in the US who are limited in everyday activities because of arthritis. Our work in this space has focused on innovative dissemination and delivery of evidence-based programs through Parks and Recreation. We've also focused on environmental approaches and community integrated health strategies like electronic health record referral pathways that link healthcare systems to community-based organizations like Parks and Recreation. Since 2016, this work has reached nearly 26,000 participants through more than 300 Park and Recreation agencies, and we've expanded the ABIE offerings to 49 states and 1 territory. Our goal during this next performance period is to get that one lingering state and maybe grab another territory as well to expand this work. Next slide, please. Okay. So on your screen, there's an image of 3 older adults who are participating in Walk with Ease, which is one of the arthritis-appropriate evidence-based interventions, the ABIEs, which I said I wasn't going to spell out again, but I did. And this is actually just down the road from me in Prince George's County, Maryland, through their Department of Parks and Recreation. As you can see in this image, there are individuals outside. They are connecting with each other. They're building social connections. They're out in nature, which there's evidence that clearly supports nature and being outdoors for mental and psychosocial health. But also we look at this as an opportunity to bring people together. So while these individuals in this image are participating in a physical activity program to improve their quality of life and prevent and manage chronic conditions like arthritis, these programs are also providing an opportunity for individuals to come together, providing an opportunity for social engagement, social interaction, and even leading to opportunities to volunteer with and engage with their local Park and Recreation agency and community-based organization for meaningful community engagement. Next slide, please. So the role of local parks and recreation in supporting healthy aging is a large one. I'm going to give you just a second to take a look at that infographic that's on your screen. It might be a little small, but hopefully you're able to take a look at it. And I'm not going to talk over you while you do that. I'll take about 45 seconds of pause here so you're able to take a look at some of those statistics on the Healthy Aging in Parks and Recreation infographic. Well, 45 seconds feels really long in this virtual remote space, doesn't it? I probably just talked over the last 15 seconds of your 45 seconds, and I apologize. But as you finish reviewing that infographic, just allude to how park and recreation agencies are a leading provider of services and recreation opportunities for older adults in nearly every town, city, and county across the United States. And whether working closely with partners or acting on their own, park and recreation professionals provide older adults with a wealth of resources that improve mental and physical health, provide social activities with others, arrange for opportunities to serve others in their community, and most importantly, allow individuals to age in place. Healthy aging is about preserving the health, independence, and social connections of older adults. For decades, local park and recreation agencies have been offering programs and services to address diverse health and wellness needs of the growing older adult population. Park and recreation agencies are seen as assets and important health and wellness change agents in their communities. Park and recreation agencies provide optimal settings for individuals to engage in a wide range of physical activity and social programs. Park and recreation agencies meet older adults where they are and provide diverse opportunities for engagement, whether it be through in-person programming or the remote delivery of programs through platforms like Zoom, like the one we're on right now. According to our latest Healthy Aging in Parks survey report, 91% of park and recreation agencies offer exercise programs that are catered to the older adult population. 70% offer field trips and tours. 67% offer arts and cultural activities. 58% provide opportunities to volunteer. And 58% also host special events specifically for older adults. These activities provide a space for older adults to come together, connect with one another, build a sense of purpose, and stay engaged within the community. Next slide, please. Okay, on your screen, if you're able to see that, this is an image of a van. This is the Get Fit Mobile that supports physical activity and social engagement for members of Prince George's County, just down the road from me here in Maryland. Again, this is an opportunity not only to get individuals who need the physical activity engaged in physical activity or get them engaged in chronic disease self-management programs, but this is an opportunity to bring these programs to populations who might not otherwise be able to access them, whether it's due to transportation barriers or other barriers. And it's another way that we can bring people together in one unified way. Bring the Get Fit Mobile out, bring people to gather in a park and recreation space, a green space, maybe partner with a local school, maybe partnered with a library for this space, but giving people an opportunity to engage in activities that help manage and prevent chronic conditions, while also adding to and enhancing their social life by building their social network, growing the nodes on the social network, and expanding the web of connections an individual might have. Next slide, please. So again, with full support from the CDC, we at NRPA continue to support park and recreation professionals to increase access, availability, participation, and sustainable support programs that improve physical activity, that improve and enhance opportunities for engagement, and ultimately improve the health-related quality of life for people with chronic conditions like arthritis. But as I've alluded to, this is a lot more than just managing chronic conditions. This has to do with social connectedness as well and decreasing isolation among an otherwise vulnerable population. As part of the project with the CDC, And in response to the COVID-19 pandemic, we launched a pilot to explore the feasibility and sustainability of delivering evidence-based arthritis management and prevention programs remotely. Through the remote delivery pilot, we not only saw increases in participation in arthritis programming during the pandemic, but we have quite a bit of qualitative data that indicates increased social connections and decreased social isolation among individuals who previously had little to no experience using web-based communication technologies like Zoom, WebEx, Google Meet, Teams, you name it. But the technology, we know that there is a gap in who knows how to use technology and how that technology is used. We also know that more than 1.4 million Americans, or more than 1.4 million people in this country, don't have access to regular internet or these technologies. So learning how to use these platforms, getting access to the internet at the Park and Recreation Agency actually allowed participants to employ these newly acquired skills to enhance their social connections with family, friends, and so on. So for example, in one of our remote pilot sites, a participant let us know through an interview that while they enjoyed being able to get back into their physical activity program, they had no idea the utility of using a technological platform such as Zoom to connect with people. After participating in the arthritis prevention and management program using Zoom and being taught how to use Zoom in that program, this individual stated that they connected with family and friends that they hadn't talked to in years. Whether or not there had been a pandemic, they still had not spoken to or seen the faces of people they cared about. But because of being part of one of these physical activity programs in Park and Recreation Agency, they gained the tools necessary to use those platforms. They were then able to connect with their friends, their family, and even build new relationships by using a platform like Zoom. So that was a really fun and exciting takeaway that we got from our remote pilot. The remote delivery pilot, like I said, it not only expanded access to these evidence-based interventions, but as we're seeing here, it helped to bridge the gap between social network nodes and to help bridge in connectedness into these programs. So this is a wonderful finding, and we're super excited to build upon that with an implementation of our health equity framework. And I'll talk a little bit about our next steps in a few minutes. Next slide, please. So why should you partner with Parks and Recreation? Why is partnering with Parks and Recreation so viable? Why is there so much utility in partnering with Parks and Recreation? As we've alluded to, Park and Recreation professionals provide access to critical infrastructure, programs, and services that improve lives. These things absolutely contribute to the fabric of a community and are important in health, well-being, and quality of life. The role of Parks and Recreation is essential to community health, resiliency, and vitality for all people. Park and Recreation agencies create a culture of impact across communities. Park and Recreation professionals have unmatched power and power that can be harnessed to protect, promote, and advance community health and well-being. Park and Recreation professionals are trusted leaders of their communities, bring life-saving benefits to communities, create and implement upstream solutions to pressing challenges. Park and Recreation agencies put people first and center the lives of the most vulnerable in the equation. Park and Recreation professionals and agencies are connected across the community and to people and partners. Park and Recreation professionals and agencies are maintainers of vital spaces, including treasured outdoor access. Park and Recreation professionals rise when called upon and take swift action to support health and resiliency. Parks and Recreation serve all people, creating welcoming and inclusive environments. And Parks and Recreation agencies and professionals are champions for change. Parks and Recreation professionals get the job done. Next slide, please. So if you're thinking to yourself, wow, I'd really like to start to partner with a local Park and Recreation agency, or a group of park and recreation agencies. The same best practices apply to partnering with park and recreation agencies that do with a lot of community-based organizations. First, an essential part of the early phase of building a successful partnership is to establish the goals early in the relationship. Different partners will see the partnership as serving different purposes. It's important to have discussions early on about the scope of the work and determine what the group hopes to achieve. Having these discussions at the beginning of forming the partnership will help you plan an engagement strategy that aligns with your work. Next, be sure to create clear project management structures. These are integral to successful collaborative models like strategic partnerships. It's important to have discussions at the beginning of forming the partnerships to understand what management will look like, how that will be funded, and what roles other partners will play. I'd be remiss if I also didn't mention how important funding the work of partnerships is. Successful partnerships often rely on members volunteering their time and resources. With full workloads and competing priorities, the partnership may not receive the attention it needs to meet the goals and objectives. So partners need to have discussions about what funding is needed early on in forming the partnership, what will contribute to capacity, what will ultimately lend itself to getting this work done while supporting the mission and vision of these organizations. Develop a messaging framework. Develop a messaging framework in which you determine how messaging is going to be disseminated, who needs to know the information, why is it important, and how is that information going to be translated to the key stakeholders. That might look different for funding partners than it does for community members. That may look different for community-based organizations like park and recreation professionals than it does for for-profit organizations or other federally funded types of organizations. And finally, well, not finally, I apologize, I jumped ahead there, but next one would be collaborating with other like-minded organizations. And this is something at NRPA that we feel is extremely strong. And it's not just collaborating with an organization that, for example, has equity in their mission and vision and their goals, but how long has equity been a part of that organization's pillars and those tenets? So collaborating with other like-minded organizations creates that sense of community. And partnership and collaboration among partnerships with aligned visions, missions, and goals creates stronger, better communities. And finally, I think this is probably one of the most important points to take into consideration anytime we're doing work that supports our communities, and why I jumped to it before the next to last bullet. Including community members in partnership building can cultivate greater empowerment, participation, enrollment, education, knowledge, program development, and enhanced research processes. Centering community members allows for the exploration of local knowledge and perceptions while empowering community members as agents who can investigate their own situations. We need to remember that older adults have been historically a disenfranchised population. Centering the older adults in your community to develop these services, to develop these strategies, makes the work credible, useful, relevant, and most importantly, appropriate. Next slide, please. I don't have much to say for this slide here. I just wanted it to kind of be that point that brings together that we are Parks and Recreation, and that there is such utility in what Parks and Recreation can do. We hold, Parks and Recreation hold power, they hold the keys to doors that we might not have otherwise into communities. Next slide, please. So looking to the future. So what does this mean for NRPA? And at NRPA, we are not necessarily Parks and Recreation. We work for Parks and Recreation. We have a lot of Park and Recreation professionals at NRPA, but we are supporting the folks who are on the ground doing this work. And we are super proud to share that with full funding support from the CDC, NRPA is going to continue this important work for the next 5 years. We're going to put equity at the center. This is one of NRPA's pillars that has been part of NRPA's strategic vision for a decade or more. But now at the center, equity is one of our pillars and will guide our work to expand access to evidence-based programs that improve both physical and psychosocial health for older adults among historically disenfranchised populations. For example, Black, Indigenous, people of color, people who are low income, people with disabilities, rural communities. As part of this project, NRPA is excited to announce that we recently closed a request for proposals from local park and recreation agencies that will support up to 55 communities to increase access, availability, participation, and sustainable supports for programs that improve physical activity, engagement, and quality of life for individuals with arthritis and other chronic conditions. This project we are calling Supporting Healthy Aging Through Parks and Recreation. Pretty simple, pretty straightforward for a title, but what does that really mean? We're going to be centering health equity in our health equity framework to continue to disseminate arthritis-appropriate evidence-based interventions, but also to address some of the key factors that we've mentioned here today: social isolation, social connectedness, meaningful community engagement among the older adult population. Next slide, please. Wow, I feel like this time has flown by, and I let my colleagues know beforehand that typically when I get into the space, I go quite a bit quicker than I normally do because I get so excited and I love what I do and I love what we do, but here we are towards the close. These are all photos that have been submitted by local park and recreation agencies over the course of the 5-year cooperative agreement with CDC that closed in September. In the upper left-hand corner, we have a group of individuals who you can see that you can't see their whole bodies and their feet, but they're on a track, they're out participating and walk with ease, and their smiles tell you everything. They are happy to be out, they're having a great time, they have that social connectedness. We see in the upper right-hand corner, 2 individuals are walking along a path, getting out into nature, getting that nature medicine, that nature prescription, but also maintaining a social connection with each other as they do that. In the bottom left-hand corner, that's the inside of one of our local park and recreation agencies. There's a party going on. There's also a physical activity component to it. And the smiles are just magnetic. Those smiles are just something that you want to see all the time. You can feel the energy coming through from that engagement piece. And in the bottom right-hand corner, what we see here is an example of intergenerational community engagement and social engagement at one of our local park and recreation agencies, which I find very, very fascinating, seeing as I manage our healthy aging portfolio, and I also manage our youth mentoring portfolio. So there's an opportunity to examine and to explore how intergenerational relationships can build social connectedness and decrease social isolation and the negative impact that comes with that. In closing, park and recreation agencies are integral nodes in the public health network and provide essential services and opportunities that not only support, but uplift communities and help them thrive. We at NRPA look forward to supporting you all as partners for a healthier, stronger, and more equitable tomorrow. Next slide, please. I would love it if you were to stay in touch. I know that a few of us on this call today, a few folks who have joined, we've done work together in the past NRPA in your organization or your individual capacity. Please stay in touch with us. My contact information is on the card in front of you. And then once we transition to our next speaker, my colleague Pam, I will put a link to our healthy aging work into the chat box. So on behalf of my colleagues at NRPA, thank you for allowing us to share this time and space with you.
Thank you so much, Tiff, and thank you to everyone for this opportunity to share with you some of our efforts to provide social engagement opportunities to older adults in sunny San Diego County, particularly through some great partnerships with parks and recreation agencies throughout our region. First, some brief background. I am a social worker by profession, and I work for Aging and Independent Services. We are part of the County of San Diego Health and Human Services Agency and are the designated area agency on aging for San Diego County. Next slide, please. So here in our county, we have an overarching vision that I want to tell you a little bit about. It's called Live Well San Diego, and it's a broad collective effort of government, community partners, and residents to build healthy, safe, and thriving communities. And it has a very proactive focus. As part of this vision, our county leadership has made some really pivotal decisions in the past several years that I think are very pertinent to our discussion today. First of all, our county has made a significant investment in intergenerational work. Thank you, Tiff, for that shout out about that. Efforts to bring people of different ages together. For example, over the years, intergenerational coordinator positions have been created within our county government structure to address critical issues in our communities through an intergenerational lens. I happily am one of these intergenerational coordinators, and my job description within our AAA is to develop, promote, and sustain efforts that bring older and younger people together for the benefit of all. Next slide, please. Secondly, we've embraced two important global initiatives that I'm sure many of you are also likely engaged in, the age-friendly and dementia-friendly communities initiatives. We call the marriage of these two Age Well San Diego. And under Age Well, teams comprised of county staff and community partners are working together on goals toward creating a more livable community in 5 specific domains. And the team I am most involved in is social participation. And the goals of our team are linked very directly to the topic we're discussing today. For example, one of the social participation team goals is to facilitate the development of shared spaces for intergenerational activity. And obviously, parks are terrific sites for this. Next slide, please. So in my role as IG coordinator, I am privileged to get a ground level view of some of these efforts. And so I'd now like to shift gears and share with you some concrete examples of how we are working together with parks and recreation agencies to engage older adults. Next slide, please. First, I want to talk about a wonderful partnership our Health and Human Services Agency has with the Department of Parks and Recreation here within the County of San Diego to support kinship families in our region, such as grandparents raising grandchildren. As many of you likely know, the number of these families across the country is growing. I read a statistic that the proportion of children being raised by their grandparents in the US has doubled since the 1970s. And these families obviously have often a very tall mountain to climb. Our county has really made it a priority to provide support to these families so they can thrive, even in what are often very challenging and traumatic circumstances. And we've received feedback from these families that they want more opportunities to just have fun with their grandkids, but money is commonly an issue. They're often on very tight budgets. Well, when having some conversations with our county parks and recreation colleagues, we found out that they had made it a priority to serve more foster youth at their sites as part of their strategic plan. Who knew? It was so awesome to hear this. So they are the ones that actually came up with the idea of hosting a camp out just for kinship families, an event that we dubbed Gramping. So with Gramping, we are able to give these families a complete camping experience together as a group with other fellow kinship families. The camping fees are waived at a county park site. Sleeping bags and tents are provided for families who don't have them, and the families get this equipment to keep, so they will hopefully use it often in the future. All the food, all the activities are provided for a full-on camping experience with a nature hike, s'mores around the campfire, you get the idea. And it's a chance to not only strengthen family bonds, but to see that they are not alone in their situation and hopefully build an informal network of peer support. We have received overwhelmingly positive feedback from the participants. Some of these families have never been camping before. And just a couple of examples of the feedback we've received. One attendee noted it was great to spend quality time together with her family without electronics for a change. A disabled grandmother told us that there was no way she could have done an activity like this with her grandchildren on her own. And I have to say, for me personally, being part of these events has been one of the highlights of my professional career, truly. So I'd now like to show you a brief video that was created at our inaugural Gramping event in 2017 to give you a better feel for this event. So if we could cue up the video, please. This is our first ever kinship family camp out, what we've dubbed Gramping. And it's a chance for kinship families to get together, have fun, meet each other. Kinship families have a tough load. They are families who are raising relative children. It could be grandparents raising their grandchildren, aunts and uncles raising nieces and nephews. We want to give them a chance to have fun with each other.
Welcome to our first Gramping experience. County Parks was able to waive the fees for the youth area in a couple different campsites, as well as we have the camping gear. So if you've never gone camping or don't have the budget to go camping right now, we are going to be able to provide everything for you.
If I could jump up and kick my feet, I would, but I can't. Let's put this on top, Mother.
I was given an opportunity to watch over my grandson at 5.5 months old without realizing that I would have to inherit him. We've learned and we're still learning together. And these grandparent meetings help us to do that.
One of the things we hear is that sometimes these families may feel kind of alone in what they're experiencing, and they're not. We estimate there may be as many as 24,000 or more grandparents in San Diego County that are raising their grandchildren. So we want them to know that there are resources there and that there are other families that are going through this so they can support each other, both formally and informally, and just really give them a fun chance to strengthen those family bonds.
It's a wonderful opportunity because being by myself with him for quite a few years, I had no idea that these programs were available to grandparents like me. I, one time, was just kind of like flabbergasted with everything that was like, oh, I have to do this. Oh, I need help here, but where do I get it from? You know, because I'm starting all over again. It'll help not only you as a person, but your grandchildren or the children that you're caring for. So do it.
Thank you so much. I'm glad we were able to show that. I think it really helps you catch the spirit of this event and just the wonderful vibe that's there as these families have fun together. In answer to a question that was in the chat, I believe from Gloria, we've done this event 3 times now. And at each event, I'd say there's probably about 10 or 12 families that have been able to participate. I think we've actually had waiting lists, and we hope, obviously, as COVID conditions improve, to be able to hold this again. So similarly, we know that grandparents raising their grandchildren often have higher rates of depression and health challenges, no surprise there, as compared to their peers who are not raising grandchildren. So we've also collaborated to create a kinship caregiver pampering event, which we've dubbed Grampering, also hosted at a county park site. And this is a chance for grandparents to engage in self-care activities like yoga and art therapy while their grandchildren enjoy kid-friendly activities. Likewise, we've collaborated with a community partner to provide day hike events for kinship families and with a Parks and Recreation Community Center to provide vouchers to kinship families, helping defray the cost of taking a class or participating in day camps. All of these efforts are centered around helping heal trauma and strengthen family bonds, especially through time in the great outdoors. These models can be followed, obviously, to help other elders, particularly at-risk elders, persons with disabilities, persons with dementia, and their caregivers. Most communities have green spaces, small or large, and with a little help and planning, including in collaboration with Parks and Recreation staff, these individuals can enjoy the many benefits of being outdoors. Next slide, please. In addition, our County Parks and Recreation Department has reached out to my agency, our AAA, seeking ideas about how they could make a park they were designing more age-friendly and intergenerationally focused, which of course was music to our ears. After consulting with each other and tapping into great sources like AARP's guide, Creating Parks and Public Spaces for People of All Ages, and we're going to pop a link to that in the chat, we came up with a list of suggestions for our friends at the Parks Department to consider, probably more than they wanted to know, but examples include intentional activities and programming like yoga, art exhibits, health fairs, structures such as amphitheaters, cafe-style seating to support such activities, even permanent weatherproof structures that encourage informal, organic intergenerational engagement, such as ping pong and checkers chess tables. A prioritized attention to accessibility with, for example, the walking trails, the seating areas. Thankfully, our County Parks Department has a commitment to enhance the accessibility and inclusiveness of their park sites. For example, they've added features like ADA compliant cabins at one of their campsites and elevated garden beds at one of their park sites. In addition, a focus on safety, especially through the eyes of an older adult, particularly someone who may have limited mobility. Is there good lighting and walkways with clear sightlines, for example? Are there areas with plenty of shade, both naturally from trees, but also through structural designs, such as gazebos and covered seating areas? Do the walking and biking routes near the park ensure safe access to it? For example, to get there, do you have to cross a busy street? And if so, does it have adequate traffic lights, stop signs, crosswalks? We really appreciated this chance to share our input, and we look forward to hopefully continued collaboration with our parks partners as they design and add features to other sites to enhance their inclusivity. So my suggestion to you is, if the Parks and Recreation Departments in your neck of the woods have not reached out to you for ideas like this, I invite you to reach out to them. Next slide, please. Another way we promote social engagement is by providing technical support to not just partners at park sites, but other community spaces such as senior centers, libraries, YMCAs. All of these are trusted places where people of different generations gather, but are not always intentionally interacting with each other. So we're working to help change that. One of our county branch sites has piloted a tech, teens, and elders computer help program where students from a nearby high school taught older adults to become more digitally literate. And as Tiff was talking about, think about how that helps an older adult become more engaged in their community, less isolated, for example, if they learn how to use Zoom with their loved ones. This concept's also been replicated at a couple of senior centers in our region. This same library branch also hosted an IG dance event where children and elders learn dances from different cultures together. And we've helped support numerous IG Games events around our county at parks and recreation sites. These are half-day events in which older adults are paired with children, usually elementary age, for fun, non-competitive physical activities and nutrition education. These events teach everyone involved that you can be healthy no matter what your age. They break down stereotypes. They build empathy between the participants. And I have to say, they are also super fun. The kids have written thank you notes for their older adult buddies that literally say things like, "This was the best day of my life. You taught me not to be scared when I played a new game. And I didn't know old people could be so fun." Next slide, please. I next wanted to share a few practical tips and strategies for you to look at when you're partnering with parks and recreation agencies in your communities to help engage older adults. First, look for common goals. Many cities have adopted age-friendly initiatives, as I talked about earlier. And when this is the case, both the AAA and the Parks and Recreation agencies have extra incentives to work together to reach more older adults with their services. Similarly, the strategic plans of your respective agencies may align very well. Your Parks and Recreation departments likely want to expand their reach and may be looking to serve more older adults, including younger, more active older adults. And as I mentioned earlier, the ways your strategic plans align may surprise you. like working with the Parks and Rec department that wants to serve more foster youth, which fuels motivation to partner to help kinship families. Secondly, remember that small and simple steps make a difference too. I realize most of you joining us today likely do not have the good fortune of having an intergenerational coordinator who's designated to propel this work forward. But my advice to you is start wherever you are and build from there. One of our parks and recreation centers has both a daycare and programming for older adults at their site, and they sometimes just have the older adults join the children for lunch or bring a show and tell item to share with the kids. So efforts like these to engage older adults can be large or small scale, involving many people or few. And third, be sure to tap into the upside of the outside, as our county's Parks and Recreation motto says. Tiff mentioned this, being out in nature has research proven benefits. We've probably all experienced that, right? Especially during the pandemic when we've been cooped up indoors, to be able to get outside, feel the breeze, see the trees, just does wonders for us. And these mental and physical health benefits can help individuals of all ages, all abilities, all cultures. And I must say, our Parks and Recreation colleagues are expert at helping people tap into these benefits through walking groups, nature hikes, gardens, and more. And take it from me, these folks are also just very, very fun, very, very rewarding for me to have the opportunity to work with them. Next slide, please. Lastly, I want to mention our broader efforts to just help older adults know about what's out there, how they can engage in the community and reduce their social isolation. We have an IG programs directory. We're going to pop the link to that in the chat. We also have a ways to engage handout, which we're also going to put in the chat, which lets them know the many different ways they can engage, including, and this is important, for those who are homebound due to physical or cognitive limitations, because that can obviously be a particular challenge. In closing, next slide, please. I'd just like to sum up our efforts here in one sentence. It's about building livable communities for all ages across the lifespan. And I have to say, partnering with Parks and Recreation agencies is truly a very powerful way to make that dream a reality. Thank you so much for listening and for all you do to serve older adults in your communities. Last slide. This is my contact information. I would welcome if any of you want to reach out to me directly to share further and dream and scheme together for your community. And I will now turn this back over to Meredith.
Thank you, Pam, and thank you, Tiff. Those were really, really great presentations with a lot of thought-provoking ideas. We just have a couple slides before then we segue to a Q&A. So this slide just highlights a few quick resources from Engage that I want to make sure all the attendees on this webinar know about. So one resource that we're particularly proud of is the Innovations Hub. It's a searchable database of innovative and replicable local social engagement programs. So again, I said searchable. So it's searchable by, for example, partners. So you can search by partner type, such as Parks and Recreation, if you wish to do that. But we also have a wealth of other resources on our website. The website URL will be on the next slide, just in case you're wondering about that. But we have toolkits and template materials. We have videos and consumer brochures and a newsletter and blog that come out each month. So let's advance to the next slide so we can see that URL, which is engagingolderadults.org. We also have Facebook and Twitter. You can find those links here on this slide, but also if you simply go to our website, engagingolderadults.org, you can find all the links from this slide there as well. Next slide. I also wanted to highlight another initiative. It's a federally funded initiative, Commit to Connect, that is working to address social isolation through developing a network of champions at the local level, working to address this issue and connect people to resources and establish new partnerships. And we're involved with that initiative as well. So you can find out more information on that at committoconnect.org. And next slide, we have a few minutes for questions. So I'll invite the presenters to turn your cameras back on, and you can go ahead and unmute yourselves as well. And let me just go to the list of questions that I've compiled from the chat and Q&A box. I think one question that's particularly important is just looking at how the partnerships between area agencies on aging or other services providers that are part of the aging network and parks and recreation agencies at the local level can kind of complement each other in your lines of work rather than perhaps duplicate. That was a question that came up. So I was wondering if you could kind of speak to how you see your respective lanes. For example, I know Tiff with mentioning evidence-based programs. It's also an area that AAAs are well involved with. But Pam, maybe you can start with that question in terms of how you've partnered with your local Parks and Rec and kind of how the AAA differs from what's offered from the local Parks and Rec agency.
Thank you for that question. I think, of course, our lane with the AAA is sort of obvious, but it's the older adults. It's being able to have connections with older adults, being able to promote through our networks. And, we often don't have the access to all of the resources that the Parks and Recreation departments have. I think of our Gramping event. There is no way we could have easily done that on our own as a AAA. We needed the park sites to be able to do that. We needed their expertise in bringing people together for a camp out. Yet we're the ones that had the connections with the Kinship Family Network. So it was a great marriage of those two things. That's just one example. I'll let Tiff weigh in on that as well.
Sure. This is really going to look different from community to community. As I mentioned earlier, we're the national, I'm here representing all of our park and recreation agencies for the most part. So we partner with some national organizations, but not so much with local entities like AAAs. We do have experience with some of our local park and recreation agencies. For example, in Missouri, partnering and working with their local AAA to implement programs and to develop programs and to work on strategic planning. But this does look different from municipality to municipality. What I'd recommend doing is doing a scan of your environment, just like we typically do as public health professionals. Do that environmental scan, do that needs assessment. And as both Pam and I alluded to in the partnership pieces, is bringing the key stakeholders to the table early to discuss goals and whether it's a good fit and alignment. I know that's a pretty ambiguous answer there, but out of the 60,000 members that we have such diversity in our communities that I'd be speaking well out of turn if I was able to say, this is how you do it for all of the communities. One of the things that we note about the community wellness hub model for park and recreation agencies is that it is not a one size fits all model and that it should be adapted as appropriate. We as NRPA, as conveners of some of this work in this space and being able to bring together park and recreation agencies and other partners, would be happy to set aside time as appropriate to meet with you all who have questions about this to continue these conversations. Perhaps Pam and I could serve as advisors of such, and we could bring in some of our other colleagues that we work with on this space. So let's keep this conversation going because there's likely nuances in the community that you're looking at that may not be like the community that's next door to me.
Yeah, great point. And love the idea about keeping the conversation going. I think we have there are certainly opportunities that ideas that are already coming to mind for me for that. Mm-hmm. And I will say, I put our URL for Engaged in the chat because I think there are plenty of questions that unfortunately we won't have a chance to get to all of them. So you can, folks who didn't have your question responded to, you can email us at Engage and we can also help connect you with the speakers. I think I'll end with one final question though. It's a brief one just so we can stay in the time slot or close to it. And Tiff, this one was for you. Somebody was curious about, you had mentioned, I think through a CDC funded effort, an RFP process that will be funding partnerships with 55 local parks and recreation departments. And that mm-hmm. person was curious how they can find out who those local departments are and perhaps that, there's potential for further partnership.
That is a really great question. And if that individual would like to contact me, we're currently in the process of reviewing those applications. So we don't have a press release yet to announce those communities. But as we get closer, we can definitely have that conversation and we'll be, as part of a light partner with US Aging, we'll be able to continue to share that information out with this network as well. So please feel free. I'll drop my email in the chat box again, just in case it's needed. And make sure it's the right one. The other day I gave someone that was a hybrid of my university email address and my work email address. It did not work.
It didn't work, no. Okay, so I think we'll just have to wrap there. Thank you so much. And Caitlin, you can pull up our final slide. And it's just a quick thank you to our speakers, Tiff and Pam, for the time you took to share your expertise and insights with us. There will be a survey that's displayed in your browser after the Zoom closes. So please take a moment to complete that. It is quite brief, but it really helps us know how we're doing and also plan future events. I also wanted to flag that there is a brief 3-month Touchpoint survey that we disseminate after each of these webinars. Again, 3 months after the webinar, but it helps us look at the longer term impact of these events. And that's part of our work plan activities for our grant. So if you see that in 3 months, which you will if you're on this webinar, please don't be surprised. That's just part of our kind of impact assessment. And again, the webinar recording will be placed on our website, engagingolderadults.org, along with a PDF of the slide deck. I think I saw somebody asked about the chat. If you would like a copy of the chat and any resources or links there, you can contact us directly. Again, if you don't have our email addresses already, you can find them on our website. And again, any other questions you have, feel free to reach out to us and we can help connect you, or you can reach out to the presenters directly as well. So thank you so much, everybody, for your time today. And I hope you have a fabulous rest of your day. Take care, everybody.